everybody, my name's Kate Still and I'm from the Information and Support team here at the Brain Tumour Charity. Joining me today we have the wonderful Matthew Jones from Carers UK, who is the Helpline and Advice Manager. We've got a number of questions from our community in regards to caring and being a carer in the current crisis. So we just wanted to go through a few of these with you, Matt, today. So firstly, thank you very much for being here. One question that keeps coming back from our community is, what advice would you give to people that now have to care for their partner as well as their children, which, you know, must be quite tricky for them in this situation?
Yeah, it will be a really tricky situation, and difficult to adapt to in some cases as well. And I think in the first instance, and I'm sure you would say the same, Kate, it's often helpful to be honest with children, if that's a conversation that you feel comfortable having. And explaining to them that the person that you care for, so it might be mum or dad in their case, needs a little more help from you at the moment, and explain to them how this might affect them. And people will know their children best, and they'll know kind of what feels right in those situations. But often the case is that it's helpful to check in along the way in that conversation, ask if they've understood, if they have any questions about how that might affect them. It might also be the case if your child's school or nursery knows that you're caring for somebody at home. They may have already been involved. You may have had a conversation with them about kind of additional support, pastoral support. So it might be an option to get in touch with the school or nursery, if they've given kind of contact details, maybe by email or telephone, and see if there's somebody that you can speak to who can maybe, give you some guidance about how to have that conversation. They may be able to help there too. There's also a charity called Family Lives, and they support families, and they have a lot of information on their website about supporting families during the coronavirus outbreaks. There might be some useful resources there as well.
Oh, brilliant. Yeah, that's really good to know. Thank you. Another situation that people in our community are finding themselves in is if they have just been diagnosed with a brain tumour, or if someone is experiencing a change or worsening in their symptoms and they have to access care for the first time. Given the current situation, are there any changes to how this is provided, or are there any restrictions in how this is accessed?
Yeah, it's a really good question. And I think in the first instance, what I would say, and particularly in the case of somebody who is living with a brain tumour or has had a diagnosis recently, is if there's any concerns around kind of change of symptoms or worsening of symptoms, it's really important to speak to your medical team. So a CNS, if you have one in place, key worker, consultant. And I say that for two reasons. The first is that from a medical perspective, it is important to discuss these changes with a medical professional. But also in terms of local support and care support in the community, they may have knowledge of how local services are being affected, and they may be able to talk to you about the most appropriate route into those services. Alternatively, if you haven't asked for this before, you could contact social services department at your local council and ask for what's called a needs assessment for the person who you care for, and a carer's assessment for yourself. And the purposes of those are to look into what additional support may be available to you. Now, in light of the current situation, there may be some delays in these assessments being provided, and we do know that some local social care services are having to be reprioritised and altered at the moment. So we would suggest, if you're contacting a council to ask for an assessment, that you ask if there are likely to be any delays, and if there's any additional information they feel you need to be aware of at the moment with how they're providing services. And it's a good opportunity to discuss any concerns that you have as well, so they have as much information about your situation as possible. Now, if you go on the Carers UK website, so carersuk.org, we do have a lot of in-depth information about how these assessments work. So it might be worth having a look on there to get some more background information. As I say, the current processes may have been altered slightly, but it will still give you an idea of what those assessments look at. And it might help just with your own thinking about some of the areas you would want to ask to be looked into. Now, if you do have support in place from your local council already and your situation has changed, we would suggest getting in touch with the social services department or the social worker if you've had one assigned to you and you have their contact details, and see if there's any ways that they can talk to you and discuss with you the change in situation and how they may be able to help at the moment as well.
Brilliant. Yeah, thank you. Really good advice. And I mean, a similar situation to that would be, of course, when unfortunately we know a number of our community may be entering palliative care or end of life care. So it's again a bit about that change in the situation. If someone were to develop coronavirus symptoms but decides to stay at home, what would you recommend that they need to consider, and where should they be accessing the support?
Yeah, so I mean, as you say, Kate, this is going to be a really difficult time for a family. And if you are caring for somebody who is approaching the end of their life and you're having to isolate as a household, we would suggest, as I'm sure you would as well, having a really open conversation with the medical professional or the palliative care team about the most appropriate ways to support the person you look after at this time. And they'll be able to talk to you about the best way to do this and help you come to a plan as well. The other thing to think about is support for you as the carer. And that's not necessarily an easy thing to do and can feel quite uncomfortable for the person in that situation too. And this will differ based on what you feel is right for you and what you feel comfortable with in your situation. And it may be having that conversation with the professionals I was speaking about just now about how they can support you at the moment. But it also might be speaking with family members or trusted friends about how they may be able to help, whether it's, for example, delivering supplies and medication to the home where you're at, or if it's just remotely kind of arranging a telephone check-in with you to see how you're doing. Mm-hmm. There's some of the things you can think about, but as I say, it will be a very, very personal decision, and it's really important that it's what you feel most comfortable with. It's important as well to keep in mind that there are organisations who can help and talk to you specifically about information and guidance at this time. So just a couple, for example, would be Marie Curie or Hospice UK. And they may be able to give you some more information and specific guidance too.
Absolutely, thank you. Finally, we know that not everyone will be at home or caring for someone at home, and lots of people will be currently living in care homes or accessing care through there. As there's been a lot of talk about care homes and the support that they're accessing or able to access within them, I was wondering if you could talk to us a little bit about what care homes are able to do to provide support during the pandemic.
Yeah, it's a really good question, Kate, and we know that a lot of carers are concerned where the person they care for is in a care home, and care homes are having to make changes to their normal visiting arrangements because of the coronavirus outbreak, and as you say, it's been covered in the news a lot that guidance is changing quite rapidly. So I would say the first thing, it's a good idea to make sure that the care home has got the best contact details for you, so that they keep you updated of any changes to the arrangements that they're making at that specific care home. You can also speak to the care home about your concerns about not being able to go and visit, because care homes will be aware that this is going to be a source of anxiety both for people who are carers and family members and friends, but also for their residents as well. So having a conversation about how the care home is supporting their residents at this time may be a helpful thing to do. This is also, though, a time where technology can be quite helpful. So again, speaking to the care home about how they can help at the moment, some of the options might be helping with arranging a video call, for example, or if they can make a telephone available to the family member or friend that you know who is in that care home. It might also be the case that you can speak to their care home about a member of staff reading, say, an email message from a family member or friend to the person who's staying at the care home, so they still feel connected with you as well.
Yeah, that's a really lovely idea. Thank you, Matt. And thank you very much for taking the time today to talk to us about and answer these questions. I know that they'll be so helpful for the community, and just really useful advice there. So really appreciate your time, and thank you very much again.
I'm really happy to help, Kate. Thanks for having me.